The Office of the Attorney General of Venezuela has called for opposition lawmaker Juan Guaidó to appear before the public ministry over his alleged links to a coup plot. Ecuador has now reported over 2,000 cases of the novel coronavirus and 75 fatalities, while Chile and Brazil are the worst affected nations in Latin America. Europe has delivered medical supplies to Iran for the first time using the INSTEX barter mechanism, which allows it to bypass the illegal US sanctions against Tehran. From the headquarters of Telesur English in Havana, Cuba, this is From the South, I'm Katrina Goss. The Office of the Attorney General of Venezuela has called for opposition lawmaker Juan Guaidó to appear before the public ministry on Thursday over his alleged links to a plan to assassinate President Maduro and other high-ranking officials. The summons came as a consequence of the investigation into the revelations by Venezuelan military deserter Cliver Alcara Cordones, who declared himself responsible for obtaining weapons which were seized on March 23rd in Colombian territory and were intended to be used in an attack on Venezuelan President Nicolas Maduro and other high-ranking officials, as well as in acts to destabilize the country. Alcala stressed that Juan Guaidó had directed the operation alongside US government officials.
This public ministry, considering in addition to latest events, we want to inform that as part of the investigation initiated last week regarding a coup attempt and assassination, that's how serious this is. Unveiled after the seizure in Colombia of weapons of warfare which were intended to enter Venezuela. We have issued a subpoena to appear before this public ministry on Thursday at 9 a.m. to one of the main persons responsible, according to Cliver Alcala. I am referring to the citizen Juan Guaidó, and I want to show here the formal subpoena.
And the Venezuelan Attorney General recalled that the Colombian government of Iván Duque was aware of the coup plot.
This arsenal was going to be illegally moved to our country and then used against the authorities of the Bolivarian Republic of Venezuela by assault groups previously trained in the neighboring nation, obviously with the consent of President Duque and the Colombian government. From Colombia, the Venezuelan citizen Cliver Alcalá Cordones himself confessed publicly to his participation in these events and stated that the attempt to transfer these weapons to Venezuela to armed terrorist groups had been carried out with direct instructions from Mr. Juan Guaidó.
Ecuador has now reported over 2,000 cases of the novel coronavirus and 75 fatalities, while Chile and Brazil are the worst affected nations in Latin America. Our correspondent in Ecuador, Denise Herrera, brings us more.
The coronavirus situation worsens. In Ecuador, the cases of coronavirus have increased since the last official report. Ecuador has now 2,240 cases of coronavirus and 75 deaths. The complaints of citizens from Guayaquil continue. They are still denouncing that they don't know how to face the sanitary crisis. They said there is a lack of resources as well as a lack of interaction by the authorities. Meanwhile, the government of Lenin Moreno said that they are taking and they are following a protocol for the removal of the corpses. They said also that the victims of COVID-19 in Guayaquil will have a dignified burial. Recently, the Secretary of Communication, Gabriela Roba, denounced a massive communication campaign against the government in order to minimize Guayaquil citizens' complaints. But as we can see in social media, the Guayaquil citizens are saying that these complaints are true. Also, the authorities reported 54 discharged patients. These people have to stay at home for 14 days on quarantine. This information is new and was included in the last report.
And residents of the Ecuadorian province of Guayas, the worst hit by the COVID-19 pandemic, have criticised a lack of state support for the families of those killed by the disease.
The province of Guayas on the coast of Ecuador has the largest number of cases with COVID-19. There is more than 1,300 confirmed cases and a lot of complaints on social media about the sanitary crisis and the lack of government aid. The Ecuadorian authorities have given excuses, saying there is a disinformation campaign against government management. However, the people from Guayas say a different story.
The sanitary system collapsed in Guayaquil. The phone number 171 is no longer working. You can spend hours on the phone and there is no response. Getting the test in Guayaquil costs a lot. We don't have a way to pay. People are dying in the street. A lot of videos are going around. We don't know which one are real. Blocks away from my house, there are drop bodies wrapped in plastic bags, waiting for some health authority to get them and take the bodies in a van, and no one cares about them.
Guayaquil streets are the stage of claims by citizens that do not know where to go. They talk about a sub-registry of the numbers regarding to COVID-19.
They are not testing anyone after the death of the person, even if there is suspicion. My brother died 3 days ago. We don't know if he had coronavirus. We will never know. He was diagnosed with dengue, suffered obesity, and he was diabetic. And we will never know. He will not enter the statistics. Besides, the pain of not being able to go to a funeral or give us a hug.
Meanwhile, complaints of irregular purchases under the concept of sanitary crisis are coming out. In a statement from the National Security Institute, it was indicated that officials involved in the hiring process will be removed. Besides, it is insisted that the government takes the necessary actions to deal with the pandemic.
We have multiplied the staff in Guayaquil to take care of this type of emergency with the necessary overalls, the necessary vehicles, and the people will be treated with dignity and respect, that from the humanitarian point of view, in accordance with this problem and the moment we are facing.
After the wave of complaints demanding to give a humanitarian treatment to the victims of COVID-19, President Lenín Moreno announced on his Twitter account that he started to work on a task force so the deceased in Guayaquil due to the COVID-19 get a funeral and a place in a cemetery.
Mexico has declared a national public health emergency due to the COVID-19 pandemic and issued stricter measures aimed at containing the fast-spreading virus. The new measures to fight the COVID-19 virus include a reduction in the maximum number of people allowed to gather in a single space to 50 and an extension of a previously announced suspension of non-essential activities. Private and social events are also suspended. Schools had already been closed and will now remain closed for a further month. Several states had already declared emergencies and issued stay-at-home orders, including Chihuahua, in advance of a federal decree. The national emergency came as Mexico reported over 1,000 confirmed cases of the novel coronavirus and 28 deaths. The Cuban government continues to implement all necessary measures to prevent the further spread of the COVID-19 virus. This Tuesday, 16 new cases were reported, bringing the total to 186, while 2 further fatalities were confirmed, bringing the death toll to 6. On Tuesday, the Civil Defense Authority in Pinar del Rio province decreed a quarantine for the municipality of El Canal after the second case of local transmission was registered in the island. Meanwhile, Cuban citizens who have returned from abroad are placed in a mandatory 14-day quarantine at a number of repurposed tourist resorts where they can be monitored for any symptoms. Many Cuban citizens who have returned have held the system, noting that they decided to return to the island at this time to make sure they would receive the best treatment possible if infected. In Honduras, protests have been reported in different parts of the country to demand access to food during the lockdown. 2 weeks have passed since the government decreed a quarantine to stop the spread of the novel coronavirus. Residents of several towns left their homes and gathered to demand food and appropriate distribution for all. In different sectors of the capital, people took to the streets and set up barricades to highlight the need for food and drinking water. The South American country has reported over 140 confirmed COVID-19 cases and 7 deaths.
The sitting is to ask for food. We are not doing anything wrong. We are not being violent. We want the government to give us the aid they promised days ago. It's been 3 weeks since this began and we live from our daily earnings. We have made a full list of all of our co-workers. We want here a serious representative who will lead us to an agreement to give us food, which is what we need. We are not asking for money. We are not asking for anything, only food.
Rico saw its largest single-day increase in COVID-19 cases, a sign that testing is ramping up, but also that the virus is spreading amidst some of the most restrictive measures of any United States territory. On Monday, the Puerto Rican Health Department said public and private labs had detected 47 new cases and that another patient had died. The island now has over 170 cases of the novel coronavirus and has registered 6 deaths due to COVID-19. The latest fatality was a 68-year-old man who had close contact with a family member who had travelled to New York, according to the health department. More stories coming up after this short break, so don't go away. New York has become a makeshift field hospital with specialised doctors and units to treat COVID-19 cases. New York hospitals are beginning to fear they will not be able to control the complicated situation in the city. Facing the prospect of the peak of infections and a healthcare system becoming even more saturated, the eastern meadows of the iconic Central Park are now hosting a temporary emergency hospital. The Big Apple has become the epicenter of the COVID-19 outbreak in the United States, with at least 70,000 confirmed cases. On Monday, the city welcomed the USNS Comfort Navy hospital ship sent to support the city's hospitals. Meanwhile, local media have pointed to questionable handling of the billion-dollar aid approved to deal with the consequences of the pandemic. And the number of COVID-19 deaths in the United States has now surpassed 3,000. More than half of Americans have been ordered to stay home, but health officials warn that the virus could kill around 200,000 people in the United States, even if all the necessary measures are adopted. There are more than 160,000 confirmed cases in the US, almost double the number announced by China. Meanwhile, the confirmed number of infections worldwide continues to grow, reaching 800,000 on Tuesday. Faced with criticisms from Congress members and health professionals over his handling of the pandemic, US President Donald Trump said that if his administration managed to keep the death toll to 100,000, it would have done a very good job. Various media outlets are pointing to a significant drop in Trump's optimism, claiming that it responds to pressure from experts in the field. However, his latest statements have drawn widespread criticism in Congress, where opposition leaders have laid the blame for avoidable COVID-19 related deaths with the president. Trump recently appeared to bend to pressure from experts by extending the closure of the nation's borders until the end of April, as well as the federal guidelines urging social distancing. The COVID-19 death rate in Germany, currently 4%, will increase in the coming days, according to the Robert Koch Institute. According to the president of the institute, responsible for disease control and prevention, Lothar Weiler, the low number of victims in Germany is thanks to the fact that the disease was identified at a very early moment and many samples were examined. 500,000 COVID-19 tests are being carried out per week in Germany. According to the official, there is no country in the world that has as many places in intensive care for artificial respiration as in Germany, although this is not enough to contain the epidemic. In addition, the president of the institute detailed that out of the 61,013 positive cases registered electronically, there have been 583 fatalities so far, while 16,000 people have recovered from the COVID-19 virus. Italian Health Minister Roberto Speranza announced the national lockdown to contain the novel coronavirus epidemic will be extended at least until Easter. The government's scientific advisors have recommended the extension of all containment measures until at least April 12th, as the nation's death toll climbed to 11,000, according to the Civil Protection Agency. Italy now has more than 100,000 positive COVID-19 cases, although the infection rate slowed over the past 24 hours. Of those originally infected nationwide, more than 14,000 had fully recovered by Monday. A WHO senior official has warned that lockdowns and stringent measures in place for the past 2 weeks should lead soon to a stabilization of the coronavirus epidemic, but vigilant follow-up will be required. Meanwhile, Spain has reported more than 400 COVID-19 fatalities for 4 days in a row. However, the increase in percentage terms was slightly lower than in previous days, according to the Health Ministry. The death toll rose to over 8,000 on Tuesday, while the number of cases rose to 94,000. Likewise, France reported its highest daily number of fatalities since the coronavirus epidemic began, bringing the death toll to 3,000. In the meantime, France announced it would pay for hotel rooms for victims of domestic violence and open pop-up counselling centres after figures showed that the number of abuse cases had soared during the first week of the lockdown to curb the spread of the coronavirus. China will start reporting on asymptomatic coronavirus cases that have been confirmed in the mainland from April 1st, an official from the National Health Commission stated on Tuesday. All asymptomatic virus cases will be centrally quarantined for 14 days. The existence of a substantial but unknown number of coronavirus carriers displaying no symptoms has raised concerns among the Chinese public that people could still be spreading the virus without knowing they are sick.
There are currently 2,161 confirmed cases, including 528 critical cases and 183 suspected cases. The overall confirmed cases on the mainland had reached 81,518. 76,052 patients had been discharged after recovery, and 3,305 people died of the disease.
A donation of medical supplies from China has arrived in Senegal. Senegalese authorities held a ceremony on Monday to welcome the aid. The West African nation has been one of the worst hit by the COVID-19 pandemic in the continent, with 162 cases confirmed so far. Zhang Xun, the Chinese ambassador to Senegal, said that his government is paying close attention to the spread of the virus in Africa and hopes to help the region in any way possible. The Federal Assembly of the Russian Federation approved special powers for the government of Vladimir Putin on Tuesday, which will allow the declaration of a state of emergency in the face of the coronavirus pandemic. The initiative had been presented last week before the State Duma, and this Tuesday received its full approval. The Russian government will now be able to establish mandatory rules should a state of emergency be declared. The authorities of each region published a corresponding decree, despite many having already imposed a mandatory quarantine for their residents. Meanwhile, Russia announced on Tuesday the creation of a high-precision diagnostic kit for COVID-19. The test kit is expected to be ready for mass production soon. This comes after the number of coronavirus cases in Russia jumped to 2,337 on Tuesday, an increase of 500, as the country recorded its biggest daily rise for the 7th day in a row. 17 people who contracted the disease have now died, while 121 people have recovered. And we're taking one last break now, but stay with us for more. Welcome back. Europe has delivered medical supplies to Iran for the first time using the INSTEX barter mechanism, which allows it to bypass the illegal US sanctions against Tehran. France, Germany and the United Kingdom confirmed that INSTEX has successfully concluded its first transaction, facilitating the export of medical goods from Europe to Iran. These goods are now in Iran, the German Foreign Ministry said in a statement on Tuesday. The ministry also noted that INSTEX will be used in other transactions with Iran, and the mechanism will continue to be developed. The first successful transaction comes more than a year after the UK, France and Germany, signatories to the nuclear deal signed between Iran and world powers in 2015, announced the creation of INSTEX as a means to evade US sanctions. The Iranian government stressed it would never forget its friends in difficult times. Iran has been hit hard by the novel coronavirus pandemic, with 44,600 confirmed cases, of whom almost 3,000 have lost their lives. And meanwhile, Iranian authorities announced that the country has deployed the necessary resources to establish emergency hospitals in the midst of the novel coronavirus pandemic. Over the last 48 hours, the Iranian army has set up an emergency hospital to treat COVID-19 patients. So far, the country has installed 3 intensive care units and several isolation units to take care of the new cases. Meanwhile, Iran expects to build more health facilities to battle the virus, despite the limitations it suffers due to the US sanctions. Turkish President Recep Tayyip Erdogan is under growing pressure from trade unions and the opposition to announce a lockdown to slow the spread of the novel coronavirus. Ankara has suspended all international flights, limited domestic travel, closed schools, bars and cafes, suspended mass prayers and sports fixtures to counter the outbreak. However, authorities have not ordered people to stay at home, even as the number of cases in Turkey has risen sharply. Erdogan insists that Turkey should keep its wheels turning and that people should continue going to work. On Monday, the number of COVID-19 cases reached 10,000, less than 3 weeks since Turkey registered its first case. Meanwhile, the death toll jumped to almost 170, drawing fresh calls for tighter measures. With Turkey emerging from a recession triggered by a 2018 currency crisis, Erdogan is committed to ensuring the recovery and refusing to enforce a stay-at-home order that would halt economic activity, calling simply for voluntary self-isolation. Sierra Leone confirmed the country's first case of COVID-19 on Tuesday. Sierra Leone becomes the 48th African country to report a case and the last in West Africa to do so. A raft of measures have already been imposed to prevent the entry and subsequent spread of the virus, including the indefinite closure of schools and other educational institutions throughout the country. The government closed all borders last week after its neighbours Guinea and Liberia did the same. Meanwhile, Guinea also announced a 9 p.m. to 5 a.m. curfew throughout the country to stem the spread of the novel coronavirus. President Alpha Conde also isolated the capital Conakry with no travel allowed to and from the rest of the country. The decision came after the country's COVID-19 cases doubled to 22. UN Secretary General Antonio Guterres stressed on Tuesday the need for a coordinated multilateral response to fight the novel coronavirus pandemic and recalled the importance of directly supporting all those who lose their jobs.
Slowly moving in the right direction, but we need to speed up and we need to do much more if we want to defeat the virus and if we want to support the people in it. This is not a financial crisis. This is a human crisis. What is needed is a large-scale, coordinated and comprehensive multilateral response amounting to at least 10% of global GDP. Developed countries can do it by themselves, and some are indeed doing so. But we must massively increase the resources available to the developing world.
And we've come to the end of this news brief. You can find these and many other stories on our website at telesurenglish.net. And join us on social media, Facebook, Twitter and Instagram. For Telesur English, I'm Katrina Goss and thank you for watching.